The next is Newcastle. Professionally, Newcastle, it is written in this format: Newcastle disease. Signs and symptoms. The common sign of symptom is shivering. The second is green diarrhea. The third is the massive death. The fifth is the twisting of the neck. These are the symptoms of Newcastle. Once you see this tick changing the neck in this format, the first thing to understand, that's Newcastle. There is no disease which has that symptom of shaking the head like this. No. 2, dropping of wings. That's having paralyzed. The green diarrhea, severe. Shivering in this format, and the massive death. The transmission, it is an airborne disease because it is viral. ABD, A stands for air, B bone, D disease. It is an airborne disease. Now, for the vaccination, it has to be vaccinated the day you learn that you have got the knowledge. Day 1. Plus. The day you get this information, it starts from there. There is no limit in age or stage. If you are to use the chemical medicine, it is drops in the mouth. Others, they administer in the eyes, but it is best in the mouth for the vaccination of Newcastle. Now, if they are many, these are chemical. And if you are using the universal ethno-veterinary medicine, still the same administration, drops. These drops, 4 drops, stops from 1 day to 3 weeks. Get me right. The administration of our ethno four drops stops at 3 weeks. If they exceed 3 weeks, it is 1 meal. I don't know whether you are getting me. If you were to be using our medicine, 1 day old, 4 drops. The 4 drops administration stops at 3 weeks. Once they reach 1 month, each one will have to be given 1 meal. If they are many, in 20 liters, you put 100 meals. If they are many, and you cannot manage to run 1-on-1, just in 20 liters of water, put 100 meals. Give them for 3 days. Because we have those which are stubborn. In that, If once you feel or you miss this, the only alternative to do, you will be missing what you don't want to understand. Newcastle is vaccinated at day 1 plus. The chicks which are 1 day to 3 weeks, the administration dosage is 4 drops. And those of 1 month plus, it is 1 meal direct in the mouth. I don't think whether we are done now. If they are many, put into water. Now this medicine put in water, the chemical medicine doesn't exceed 24 hours. Every chemical medicine administered in treating either animals or chicks, if are mixed or dissolved in water, don't exceed 24 hours. If they exceed 24, it becomes poisonous and toxins. But for our ethanol, the more medicine is in that water, the more it stays there, the more effective and powerful it becomes. That's the difference. Are you getting me? I know some people are noting. If we are to be using the chemical medicine, they don't exceed 24 hours if that medicine is dissolved in water. But for ours here, you may have like 100 chicks or even 5, and you would desire to be putting into water. Get 20 liters of water, put 100 mils of water, or of the medicine, give them routinely, continuously, till this medicine is finished in the jerry can. Have no overdose. I thank you for liking and viewing. With me, Isa Luigare. Newcastle here has no chemical treatment. But for us, we have it. The treatment, it is the same, either in drops or in water. Use whichever is applicable. The administration is for 4 days if we are to be treating. You see, my people, I love you so much. And whoever is viewing, you are the one who made me to be, however much that I'm the presenter here. But if you were not there, I wouldn't be here. But still, I to be here with you, it is living agriculture's objective and role and vision and mission to see how can we transform the lives of the community on the social media. This is why you find that other people on other social medias can post somebody who is naked on TikTok, can post somebody who is on a knicker on TikTok. Somebody can upload a video when he's dancing nakedly. The question on my small understanding there raises, who is dancing? Are you advertising such that you get those ones who needs to be trained to dance as you do? That's my, it itches me in my eyes and head. Because people keep on lamenting and shouting as there is too much poverty. What do you use with your smartphone. What do you advertise? What do you have to sell and you don't have buyers? Are you selling your negativeness? Are you selling your activity of dancing? Are you selling Isa who is mixing his feeds for chicks? Because some people, they abuse what they have and they keep on complaining as there is poverty. In the entire world, there is no poverty. Get it right from me. We calculated earlier, somebody may start with only 4 hens with 1 cock. In a period of 1 year, should be having over 70,000 chicks. This is practical and real. And they keep on blaming the government. The government have not helped us. When you have a smartphone and you are just posting nakedness, simanyi oba amagezi tuba tuyina. Living agriculture, we are here to see that whoever needs knowledge, whoever needs the technical services, whoever needs the skill, whoever needs the information fully, we share it here. That's why you like us. But my biggest challenge is our partners in the same industry have betrayed us. Why? That instead of sharing what we are doing, there is a reason why I told you about the Madame Aringa. I don't know where she is, but this is the one whom we have the same vision and mission of sharing what we do. So please, my viewers, if you are disappointed with me, I don't care. You go to somewhere where you will get what you need to hear. But as living agriculture here, we are to train, not to entertain. Any disappointment? Change the channel. This is me. Now, I told you, Newcastle has no chemical treatment. It is only plant medicine, which treats Newcastle instantly. Thirdly is the infectious bronchitis. How do you identify this? They start wheezing and breathing. The respiratory system becomes weak. They start sneezing. And for the mature ones, at times, the females, they lay the eggs which are not ready, premature. But mainly the infectious, this one is a result in this of the avian flu. Respiratory system becomes a problem. It's an attacking of the lungs, the IB, infectious bronchitis, swelling of the head in this format. IB. Transmission, it is ABD. Vaccination, 1 day old, 14 days, and 28 days. Using the chemicals, it is advisable for those who are in long-term business, like locals, layers, croilers, Sasso, Rainbow, Sussex. In every vaccination you administer, add this IB. 2, I add Newcastle. If you are vaccinating Malex, using the chemical medicine. This is the format. Malex day 1, NCD, IB1 and IBD1. Whoever is viewing here, when you are in the industry of producing 1-day-old chicks, could it be local, could it be broilers, make sure get these vaccines and mix them together. The administration is injectable. Some people think that broilers cannot be vaccinated against Malex. We have some farmers who sell them at 5 months. What if they were not vaccinated against Malex? I have come across these cases and tired of them. Every producer there